California is once again at the center of a troubling national trend: surging COVID-19 rates. Health officials are sounding the alarm, warning that the state's infection numbers have skyrocketed to some of the highest in the country. But here's where it gets concerning. This surge comes amid delays in the vaccine rollout, leaving many vulnerable populations exposed and raising questions about how prepared we are for the next phase of the pandemic. Could this be the moment that changes public opinion on vaccines? Let's dive into what's happening. Across California, from Los Angeles to San Marino, health departments are reporting alarming increases in cases. According to Dr. Matt Willis, former health officer of Marin County, California is currently experiencing a significant wave of COVID-19 infections, with statewide infection rates ranking among the worst nationwide. Emergency room visits related to the virus have surged dramatically, particularly for two groups: children under 12 and seniors age 75 and older. For kids, hospital visits due to COVID are now more than double the state average, while ER visits for older adults have nearly doubled in just 1 month. The culprit behind this latest spike? Experts point to a subvariant called Stratus, which has quickly become the dominant strain across the U.S. This variant appears to spread faster than previous strains, making it especially challenging to contain. Even wastewater samples, a key indicator of community transmission, are showing widespread viral activity throughout the state. And as schools reopen for the fall semester, medical professionals like Dr. Elizabeth E. Hudson, Regional Physician Chief of Infectious Diseases for Kaiser Permanente Southern California, predict that pediatric cases will rise sharply in the coming weeks. But this story takes an even more controversial turn when you consider the role of federal policy, or lack thereof. The Trump administration's handling of the vaccine rollout has been criticized for delays, raising concerns about whether timely protection against new variants will reach those who need it most. By June of last year, the federal government had already greenlit updates to the annual vaccine formula. However, this year, leadership within the Department of Health and Human Services has shifted toward skepticism. Under Secretary Robert S. Kennedy Jr., known for his vocal doubts about mRNA technology, advisory committees have been disbanded, and recommendations scaled back significantly. In May, Kennedy announced that the Centers for Disease Control and Prevention would no longer advise routine vaccinations for healthy children or pregnant women. He framed this decision as both logical and scientifically sound, tweeting, "We are now one step closer to realizing Trump's promise to make America healthy again." While this move aligns with certain ideological perspectives, it clashes with guidance from organizations such as the American Academy of Pediatrics and the American College of Obstetricians and Gynecologists, both of which continue to advocate strongly for vaccination. Dr. Peter Chin Hong, an expert in infectious diseases at UC San Francisco, warns that these shifts could create massive barriers to achieving widespread immunity. Meanwhile, Dr. Peter Chin Hong, an expert in infectious diseases at UC San Francisco, warns that these shifts could create massive barriers to achieving widespread immunity. Meanwhile, Dr. Peter Chin Hong, an expert in infectious diseases at UC San Francisco, warns that these shifts could create massive barriers to achieving widespread immunity. Willis emphasizes that California finds itself in a precarious position, a limbo created by inconsistent federal support for vaccines. With the 24-25 version of the vaccine slowly phasing out and limited access to the upcoming 25-26 formulation, Californians face heightened risks as transmission rates climb. So, what can individuals do to protect themselves during this uncertain time? Dr. Willis offers practical advice for navigating the current landscape. If you're in a high-risk group, seek out available doses of the current vaccine immediately. Local resources like MyTurn, https://myturn.ca.gov/vaccinelocator.html can help locate providers. Consider signing up early for the next round of shots if you can't get vaccinated right away. Wear an N95 mask indoors, especially if you're part of a vulnerable population. Stay informed through trusted sources, including social media channels like Instagram, https://www.instagram.com/p/dnniw. Understanding the specifics of the Stratus variant is also critical. Classified as XFG by the CDC, this strain originated in Southeast Asia earlier this year before spreading globally. It's described as a hybrid of two Omicron lineages, LF.7 and LP81.2, and experts believe it may evade immune defenses better than its predecessors. Though symptoms largely mirror those of other Omicron variants, including sore throat, fatigue, congestion, and fever, one unique hallmark stands out: hoarseness. Often described as feeling like a razor blade in the throat. As Stratus continues to drive case numbers upward, debates over vaccine policies grow increasingly polarized. Should healthy individuals prioritize vaccination? Are current guidelines sufficient to safeguard public health? These are questions worth discussing, and ones that deserve your input. Share your thoughts in the comments below. Do you agree with the recent changes, or do you think they put us all at greater risk?